Welcome to Module 3, Embedding Definitions in National Policy, Standards, Regulations and Plans. By the end of this module, you should be able to describe SMS target setting at the national level and identify opportunities for reflecting SMS in national targets. Recall in what mechanisms, e.g. technical guideline, utility regulations, SMS can be reflected. What can be included in those mechanisms to reduce risk? And think who is responsible along the SMS chain, particularly where there are gaps or overlaps in responsibilities. And know an example of where system strengthening for SMS has been successfully applied. This module draws mostly on Chapter 4 of the WHO Guidelines in Sanitation and Health. You can look there for more detailed information. Sanitation programs are delivered through a national implementation framework, but sanitation services must be accessible to people where they live. So, the focus of implementation is at the local level. In this module, we are going to talk mostly about reflecting SMS definitions and targets at the national and local government level at the top of the diagram. But first, a quick word on the lower part of the diagram: customer services, public services, and infrastructure. You'll see in the lower right, large infrastructure planning and costs can be partly covered from the national level, since they require major investment which possibly only high-level national, regional, or external financing can provide. Customer services and public services are at the local level. Let me demonstrate using the sanitation chain. Do you remember our sanitation chain from the earlier module? Here it is. In yellow are the customers or individual services such as toilet construction, hardware supplies, removal of fecal sludge or containers, and provision of public toilets. These provide direct benefits to users as well as help improve public health at the community level. These services are typically provided by small commercially viable businesses. However, poorer households are likely to need subsidies to access these services. Subsidies are justified because having all households covered will deliver health benefits for everyone in the community. Shared or public services are in green, such as operation and maintenance of sewerage and drainage systems and fecal sludge treatment. These are delivered downstream of users, producing public health benefits to the community, and may not be possible or fair to finance entirely by direct user fees. They are usually delivered by local authorities or utility companies and may also be subcontracted to the private sector and may be funded through, for example, local tax revenue, cross-subsidy from water supply, and government subsidies. In this graphic, please note that delineation of individual services and shared services does not signify who should bear the full cost of service. As we know, the global goal is for universal access to safely managed sanitation by 2030. However, no region is on track to achieve this. Many countries need to progress at more than 2% per annum to achieve universal SMS by 2030. That's faster than the fastest rate of progress for any country in the 2000 to 2015 MDG period. Globally, rates of progress need to quadruple. The rate is higher, as much as 8% per annum, in lowest income countries. Clearly, this is a huge challenge, and it would be unrealistic for all countries to set universal SMS by 2030 as their national target aligned with the SDG 6.2 target language. Hence, countries need to set ambitious but realistic targets for sanitation based on a robust analysis of the current situation and potential for accelerated progress. One thing to note is that while safe disposal in situ may be quite realistic for rural areas, it is unlikely to be safe or sustainable in urban areas. Since 2000, however, on-site sanitation in urban areas is growing twice as fast as sewer connections. This poses a serious challenge for emptying and treatment of fecal sludge from on-site systems in urban areas in the years ahead, to scale of emptying and transport services. That will entail growing the workforce and making sure those jobs are dignified and safe. Okay, now let's think about setting targets for safely managed sanitation. We can start by using the SDG 6 service ladder to set targets for each service level. For example, elimination of open defecation, reduction in unimproved and shared toilet facilities, a certain minimal percentage with basic sanitation, and a certain percentage with safely managed sanitation. This could be broken down further into three types of SMS, i.e., percentages for people with sewered connections and wastewater treated off-site, percentage with excreta emptied and treated off-site, and percentage safely disposed in situ. However, national targets and strategies need to be based on a solid situation assessment, and countries may wish to break down SDG service levels into their component parts, e.g., different types of services, technologies, and systems. Risk-based target setting can be useful as part of this process, particularly the use of tools such as excreta flow diagrams, also called shit flow diagrams, to identify the major unsafe practices to be prioritized for phasing out. Disease data to prioritize sanitation investment in high disease prevalence areas. Other disaggregation, such as poverty, ethnicity, geography, might be used to set disaggregated targets. National sanitation policies and strategies should include clearly defined objectives based on a systematic analysis of the sanitation situation, which includes an understanding of how excreta flow from point of generation to end use or disposal and the associated public health risks. Here are 4 steps of the analysis. 1. As a first step, the multi-stakeholder platform should complete a situational analysis of existing legislation, policies, and practices, as well as an assessment of levels of access to and overall effectiveness of sanitation in different contexts and geographic areas. 2. Sanitation standards and targets should be set to improve public health and in alignment with human rights principles. 3. Standards for sanitation should be clearly defined based on a systematic analysis of public health, sanitation access and behaviours, legislative, policy and regulatory landscape, institutional roles, financing and capacity. And finally, targets, which are stepping stones towards meeting standards, may be mid or long term based on the context and available resources to allow for incremental improvements and increasing equality in access to services. Long-term planning should identify how meeting targets ultimately leads to the attainment of all sanitation standards for universal access to sanitation and improving service levels for the poorest, disadvantaged, and most marginalized groups. Very few governments can immediately achieve the standards that they have set. The process of target setting recognizes this, giving opportunity to prioritize where efforts should be placed to reach the standards and comply with human rights principles of equity and non-discrimination. Targets may be national, and they also may be targets set at the regional or local level, generally set by the relevant level of local government. Targets should include publication of plans and budgets so that people know how and when they can expect services to improve. National sanitation targets should be based on the results of the situational analysis. Targets or milestones should define priorities, be time-bound, and as far as possible, measurable, so that those responsible for attaining the targets can be held accountable. These can be defined according to many criteria, including targets based on health, targets for achieving service provision for particular population groups, particularly poor and disadvantaged groups, targets for types of service provision, budgetary targets, targets for particular behaviors, targets for achieving institutional arrangements or for regularity of monitoring. Most countries have targets for different types of services, technologies and systems. To ensure that they are relevant and supportive, representative scenarios should be developed, including description of assumptions, management options, control measures, and indicator systems for verification. These should be supported by guidance addressing the identification of national, regional, or local priorities and incremental implementation, thereby helping to ensure that the best use is made of available resources. Targets for realizing the policies and standards for sanitation must be established by a high-level authority responsible for sanitation and health in consultation with other stakeholders, including local authorities, sanitation service providers, and local communities. For example, targeting smart stepping stones for incremental improvement may look like this. As we know, SMART stands for specific, measurable, achievable, relevant, and time bound. Here, high priority risky practices and services such as open defecation or manual emptying, shown in red, brown, and yellow, are being phased out over time and replaced with SMS options, blue green. Over time, from left to right, you see movement from a high proportion of unsafe practices to a mix of service types, all of which are safely managed. Targeting to high disease, low sanitation areas is also an approach. For example, WASH NTD overlay maps can show areas with high NTD prevalence and low WASH coverage, such as with Ethiopia's WASH and worm overlays, where you can see areas in red with low sanitation coverage and high prevalence of soil-transmitted helminths and schistosomiasis, which can be priorities for sanitation investment. At the end of this module, we'll share a link to those overlay maps. You may live or work in a country that has national strategies and plans for sanitation, or live in one where they need to be developed. In both cases, good questions to ask when updating existing strategies and plans or developing new ones are: how well do your national targets and plans already cover SMS? Does the National Situation Assessment cover SMS? And what opportunities are coming up in your country to update national targets for SMS? These questions are urgent because the clock is ticking to meet SDG Target 6.2. So, when embedding safely managed sanitation in national systems, who does what, when, and where? In this section, we will address these issues. They are overarching principles for sanitation legislation, regulation, standards, and guidelines. We know that national interpretation of SMS at each step of the chain is vital, as there is no one-size-fits-all blueprint. Also, sewered and non-sewered sanitation systems need to be explicitly recognized or differentiated. Service quality must be regulated based on public health risk assessment and management. Sanitation technology standards need to be formulated, locally relevant but non-prescriptive, and include ongoing operations and maintenance aspects. Levels of performance criteria need to be set out, but allow flexibility on how it can be achieved. Legislation and bylaws at national or local level are both necessary. The steps in sanitation service chains differ and require a range of regulatory mechanisms. There is not one but many mechanisms to consider along the sanitation chain as per figure 4.4 of the WHO guidelines for sanitation and health. For example, public health protections for SMS may be reflected in a combination of building codes, technical standards, licensing of service providers, or utility regulation, for example. An important thing to note is that these need to work as a coherent set that are mutually reinforcing. What can be included to reduce risk and reach SMS? Now let's look at what can be included along each step of the sanitation chain to reduce risk and reach SMS. Reducing risk in toilet, containment, and on-site treatment requires mechanisms to regulate quality of installation and construction of on-site sanitation systems in premises with formal tenure. Goods and infrastructures, such as septic tanks, can be regulated with national technical standards. Industrially producing components, e.g. precast septic tanks, that are covered by technical standards or consumer protection. All of these are especially relevant when there is no formal tenure or in informal or illegal settlements. Reducing risk in conveyance requires good utility regulation. For example, a public utility with specific regulatory responsibilities and arrangements. A private enterprise contract, or service level agreements. Employers should ensure that workers are protected with periodic health checks, vaccinations, PPE, etc., so occupational health and safety regulations are necessary. Satisfactory licensing where, for example, accredited private sector entities provide services independently, such as pit emptiers and dealing with customers. Ensuring public health and nuances by mitigating the impact of unintended effluents such as leakages from sewers and intended effluents such as dumped fecal sludge. Reducing risk in wastewater treatment. As with conveyance, which we just looked at, the utility, occupational health, licensing or accreditation, and public health and nuisance abatement responsibilities are the same. What is additional has to do with technical standards for liquid, effluent, and sludge. In this case, it is important to set one or more incremental standards to promote incremental improvements, so high standards are seen as attainable. Standards should be developed with support meeting the intended use or disposal for the wastewater and solids. Reducing risk in end use or disposal requires knowing where the wastewater or solids may be used. For example, in agriculture, horticulture, aquaculture, groundwater, recharge, or energy. Standards need to be developed for the intended use or disposal, as well as special protection for farmers reusing sanitation products and standards for private sector operators selling processed sludge products. As with conveyance and treatment, public health must be protected and nuisances abated from unintended effluents like leakages from sewers and intended effluents from dumped fecal sludge. Lastly, but in fact most importantly, is the question of who is responsible for sanitation regulation and oversight. Sorting out possible overlaps or gaps in areas of regulation and oversight is an essential first step. In fact, the roles and responsibilities in regulating sanitation can vary because there are multiple mechanisms available to regulate one or more parts of the sanitation chain, and different sectors and institutions are involved with relevant legislations and regulations, and these sectors and institutions are widely scattered. Identifying, updating, and aligning all responsibilities may be required before updates to the mechanisms themselves can begin. Similarly, clarifying responsibilities for service delivery for all at the local level and accountability mechanisms from service providers to the regulations described on the previous slide is equally important. We've reached the end of Module 3, Embedding Definitions in National Policy, Standards, Regulations and Plans. Here are the take-home messages. 1. Set ambitious but realistic targets for SMS. In doing so, you will want to break down targets into component parts, identify high-risk and unsafe elements, and set targets to phase out unsafe practices over time. 2. Look to include SMS definitions in relevant national policy, legislation, regulations, standards, and guidelines. Take note that there is not one but many mechanisms along the sanitation chain to consider. 3. Make sure definitions, as explained in Module 2, guide development on content that meets minimum requirement for SMS. The mechanisms should be aligned and work together. Finally, and most importantly as your first step, be sure to identify and address gaps and overlaps in mandates for oversight, regulation, and service delivery. Need more information? See Chapter 4 of the Guidelines for Sanitation and Health.